Charles the two turkeys President Biden pardoned today, not for sale, but the turkeys that people need to go buy for Thursday's festivities. Much more expensive than last year. We have a few graphics. A 16-pound turkey is up to $28.96 plus 21.
Hi, can folks hear me? Put a thumbs up if so, please. Perfect. Hey, Dr. Tepperman, nice to see you. We're just giving it a few more minutes to let folks join the virtual room. I see we're being joined by my wonderful co-chair, Dr. Katz. Hi, Dr. Katz.
Hey, how you doing?
We're gonna give it about 4 more minutes with the start of 4:05, just to let everyone know we are already live on YouTube, where the public will be able to view the task force meeting and the conversation around the task force taking place. And we will then also post it on YouTube afterwards and social media so folks can see it. We had some technical difficulties last Friday and an emergency in the district. And then today it was some more technical difficulties with MailChimp. We're trying to send out the email to the community about viewing it. But the community is able to submit comments to District 31 at council.nyc.gov at any point in time. And so again, we'll get started at 4:05 p.m.
Good afternoon. This is Dolores Orr, and I'm on the phone number ending in 6062.
I'm sorry, who is that with the phone number?
Dolores Orr.
I'm sorry?
Dolores Orr.
Whose number is ending with 062?
Councilwoman, that's Dolores Orr, the community board chair.
Thank you. I was unable, I'll rename it so we know who that is.
Thank you.
Hi, Dolores.
Hi, everyone. This is Betty Leon.
Hi, Betty. We'll get started at 4:05. Just so you know, we're already streaming live on YouTube. So
Okay.
just giving everyone a heads up that it's being recorded already.
Okay, great.
Thank you. Okay, good afternoon, everyone. Thank you for joining our kickoff for Rockaway Trauma and Healthcare Access Task Force. This task force, as many of you know, came about in working in tandem with the Adams administration, recognizing the need for a trauma facility on the eastern portion of the Rockaway Peninsula. Also understanding that we are projected to grow with significant development underway on the peninsula. 10 years ago, we lost our only trauma hospital, which was Peninsula Hospital. And we currently only have one hospital, which is St. John's Hospital. And the Rockaway residents are left to really rely and depend on Jamaica Hospital for any trauma-related treatment. And so we will get into the goal of the task force and the agenda, and as well as discussing some of the vision that the community has. This task force consists of medical experts and elected officials that represent the Rockaway Peninsula and community leaders. And so each member on this task force from the community represents a constituency. We try to be as inclusive as possible. And we welcome comments to those who are viewing to be sent at any time via email to district31@council.nyc.gov. And so the agenda for today will be welcome, which I'm doing right now, and I'm going to kick it over to Dr. Katz shortly to give welcoming remarks as well. We'll do our introductions. We'll also talk about why this task force matters a bit more. Goal setting, the work ahead. We'll have a brief open discussion, and then we'll close out with providing the dates for the next several meetings that we'll have. The goal is to have this task force last between 4 to 6 months. And by the end of the task force, we are looking to have recommendations on how we can move forward towards developing and establishing a trauma facility on the eastern portion of the Rockaway community. That does not mean that in 4 to 6 months we will have it, because we'll learn in this process that is going to take a number of ingredients to actually create one, including capital, location, and so much more. But this is a critical first step that we need to take for it. And I thank each of you for rising to the call, for being a part of this task force in this important conversation. So with that, I am going to pass it over to my co-chair, Dr. Mitch Katz, CEO of New York City Health and Hospitals.
Well, thank you so much, Council Member, and I'm really honored to co-chair this with you. Health and Hospitals is the public system in New York City, and I think we showed during COVID how well the public system can perform. Our hospitals took care of the needs of the city and expanded our ICUs when we needed. We provided testing when we needed, when that was what people needed, and we have always had the strongest commitment to underserved populations, to immigrant populations, to the Black and Brown communities, to people who really need us. And I hear this very much about Rockaway. I recognize that we're talking about a growing population that is in the Rockaways and that doesn't have access to a trauma facility except by a long transit time to Jamaica Hospital. And I'm very interested to hear from community members a little bit more about what people want from that facility. I think a key issue in sizing it, in staffing it, in financing it, is a deep understanding from the community on what we want in that facility. We recognize, everything is not possible in a hospital, even in our most advanced trauma center, which is Bellevue, where the president would go if, God forbid, he was shot. We don't do everything. There are always things that are done in specialty hospitals. So I think figuring out what are the trauma and other healthcare needs that are really responsive to the community's needs, so that whatever we build, I want people who are part of this committee to feel proud that whatever we created was what people wanted. So with that, I look forward to hearing more from others who live in the Rockaways about what kind of facility would meet their needs. Thank you, Council Member.
Thank you so much, Dr. Katz. And I just want to say that we are so fortunate to have you as our co-chair on this, for also the guidance that you've given me thus far as a council member, and recognizing the need. You've been from the very gate extremely supportive of finding a way to fill a gap that we have here in the Rockaway community. And so I'm thankful for you lending your expertise to us in this way.
My pleasure.
So with that, we're going to just do a round robin of who's here virtually in the room. I ask that you say your name, your organization affiliation, and then we'll just go from there. So if you can pass it to the next person. So like I introduced myself and I pass it to Dr. Katz. So I'm going to call on the first person I see, and I ask that after you do your introduction, you just pass it to the next person. And I'm going to start with Dr. Sheldon Tepperman.
Thank you, Councilwoman. Can you hear me?
Yes.
Hi, and my wonderful friend and boss, Dr. Katz. Good to see you and happy holidays to everybody. I am Dr. Katz's chief trauma surgeon, so the trauma service line lead for New York City Health and Hospitals. I run Jacoby Trauma Center. I'm the trauma medical director here, and I help Dr. Katz oversee our 6 trauma centers. I'm his subject matter expert on trauma services and trauma centers. And over to our next member.
I think that might be me. I'm Marvin Holland. I'm the chief of staff, and I'm representing State Senator James Sanders Jr. on this call. And I'll pass it over to Miss Betty Leon.
Betty, you're on mute.
Sorry about that. I am Betty Leon. I'm in a number of organizations in the Rockaways. I've been a nurse for many, many years at Kings County Hospital, and you know that's one of the big trauma centers in the Brooklyn.
Betty, you're supposed to
Yes,
pass
I
it to the
pass
next
it over.
person. I'll just keep tally of who it is. Well, next kick it to our Assembly member, Khalil Anderson.
Thank you so much, Majority Whip, and thank you to everyone who's on the call this afternoon. For those who don't know who I am, my name is Khalil Anderson. I proudly serve as a state assembly member for the 31st Assembly District here in Southeast Queens. Really looking forward to a successful task force and delivering resources for our district around this issue of trauma care and healthcare for the peninsula. We have over 130,000 residents on the peninsula, roughly, give or take. If you all read State Controller DiNapoli's economic snapshot, the healthcare industry, which we helped him work on, the healthcare industry is the top employer on the peninsula. So this is a high stakes issue, not just for employment, but for healthcare services on the peninsula, as well as much needed trauma care services on the peninsula. So I commend you, Councilwoman, and to Dr. Katz, our Brooklyn cat who's here in Queens, for being on this call and championing this task force. I'm looking forward to progress. So I'm going to kick it over to, I see Dr. Vega. That's who shows up first on my screen. Go ahead, Dr. Vega, unmute. You're still on mute. If you're on the phone, press *6. All right, while you get that settled, let me kick it over to Dr. Mullins, Reverend Mullins.
Good evening, everyone. Thank you, Assemblyman. It's always good to see you and hear you. Kudos to our Majority Whip and Council members, Sylvina Brooks, for championing this initiative, which is well needed, very well needed in this peninsula. My name is Les Mullins, Pastor Mullins. I'm the senior pastor of the Rockaway Community Church of the Nazarene. I'm also the founder and CEO of Challenge Charter Schools. Glad to be part of this. I kick it off to my friend Richard Altaby.
Thank you, Reverend Mullings, and it's an honor to be part of this illustrious group to fulfill such a big need in the community. We don't have Peninsula Hospital anymore, and St. John's is not exactly up to par, and we really have a large population with very little service. And so if we can fix that through our work, it's amazing. I'm the president of the Jewish Community Council of the Rockaway Peninsula. I'm also a principal of a local yeshiva in the 5 towns called the Hebrew Academy of Long Beach, and it's an honor and a pleasure to be part of this group. I kick it over to my executive director, who I saw here before. I don't see her now. Is she here? No. So Allison Dealey here.
I saw Allison, but I think she may
But
have
she's
dropped out.
out. Okay.
Yeah.
So I will kick it to Alan Silverstein. No. Oh, you know what? I see Miriam Vega's not muted anymore. Go take it over, Dr. Vega. Go ahead.
Hi, how are you? Hi, everyone. Good afternoon. Thank you so much for inviting me to be part of this. It's a great honor, Councilwoman, to be on this with you. And Mitch Katz, Dr. Mitch Katz, we met a long time ago in LA when I was CEO of an FQHC out there. So I know what good you did in LA, especially with the uninsured population. So it's great to see you in New York.
Thank you.
I am the CEO of Joseph P. Adabo Family Health Center. We are the FQHC in the Peninsula, the largest provider of primary care there. And trauma and mental health issues are a big passion of mine, as I am a psychologist by training, and I know there's a lot of needs. So I'm eager to participate and see what we can do for the community that's much need. Thank you all.
Thank you, Dr. Vega. And I think Alan Silverstein had his hand up, so I think he can come off the mute now. Alan, are you able to come off?
Okay, I'm off.
Okay, well,
How are you?
there you go.
Okay, I'm asked by Senator James Sanders to be a part of this first meeting. It's a little bit of a long but short story. I'm sure everybody read about a recent reunion at Far Rockaway High School. I was the chairman of that 1,500 person reunion, and I met Senator Sanders, and I also met his staff, and also Assembly Member Anderson. How are you, sir? I was approached because he was somewhat surprised that there were so many alumni that came to join this event, that he really didn't know that Rockaway, for people like myself that were born and raised there and still have a connection there, we're so passionate about the peninsula. And we go back to the mid-50s, and we still have a connection in the Rockaways. But I'll make this as short as possible. In multiple meetings with Senator Sanders, we represent a fairly significant.
Alan, you went on mute.
Do you hear me?
Now we do.
Yep. We represent a fairly significant hedge fund group with a lot of ex-Far Rockaway residents and alumni. And in meetings with Senator Sanders, we said, well, if you had to put a bucket list together, what would be one of your most important things besides education? And he said a trauma center. And I said, well, if that's your two most important items on your bucket list, maybe we can assist you with this on the financial end of it. So Senator Sanders asked that I join the meeting.
Okay, so you're the money person. Got it. Thank you. Next, we're gonna kick it to Gina Bittner, Queensborough President's Office.
Hi, everyone. My name is Gina Bittner. I'm the Director of Health and Human Services for Queensborough President Richards. Happy to be here. So I guess you want to kick it off to someone? Or should I?
You can do it.
Okay. Sonia Moyes. Sonia?
Hi, I apologize. Can everybody hear me?
Yes.
Yes, hi, good afternoon, everyone. My name is Sonia Moise. I am the president of Edgemere Community Civic Association, and I'm also a board member of Community Board 14. I am a registered nurse for over 20 years with a specialty in critical care, mainly the ICU. And I did work at Peninsula Hospital in the emergency room for 7 years per diem. And I'm currently a nurse informaticist. So that's what I do. And I am happy to be amongst everyone in the, on this committee. Thank you.
Can you kick it to someone, Sonia?
I'm sorry, because I'm driving. So if you could just kick it off to someone,
I'll
I
kick
appreciate
it.
it.
You focus
Thank
on
you.
the road. I'll kick it.
Thank you.
We'll kick it to Payman Lodi.
Thank you, Council Member. Hi, everyone. Payman Lodi, Head of External Affairs for New York for Tishman Spire Properties. We've got a very exciting project in Edgemere called Edgemere Commons, where we're building the remaining, or we hope to build the remaining 10 of the 11 buildings at the site. Thank you for having me.
Thanks, Payman.
I'm not sure who to kick it off to next. I'll defer
Trying
to
to
you,
see
Council
if,
Member.
I think Dolores or CB14 Chair. Dolores?
Good afternoon, everyone. My name is Dolores Orr, and I'm Chair of Community Board 14. And this is something that Community Board 14 has been requesting since we lost Peninsula Hospital and the trauma center that was there. And our thanks certainly to Councilmember Brooks Powers. In our Community Board 14's approval on Arverne East projects, which is from 32nd Street to 35th Street, we had conditions that we would not support that project unless one of many things, but certainly critical was we would not support the project unless we had a trauma center. And I know that the councilwoman worked 7 days a week, round the clock at the time that approval was on the table. So we thank you very much, and I'm very happy to participate in this. Thank you.
Thank you. And I just let a Zoom user in, and I'm assuming
that's me.
that is Jerry. Oh, sorry.
Sorry.
I'm assuming that's Jerry Romsky with Arverne by the Sea.
Yeah. Thank you.
There's a slight echo. I'm not
Let's
sure
all
if
go
you-
on mute if you're not speaking.
Thank you. Okay, so Zoom, you're off. Is that Jerry Romsky from Arverne by the Sea?
Yes, that's me, Selena. How are you?
Is that you?
Yes, what, the 914? Yes.
What? Okay, so I will rename it so we know who that is. Perfect. Okay, so now we have done that. We also are joined by Jack Siegenthaler, who is with my team. He is our policy and budget director, who will be running point for us and from a staff perspective on the task force. So everyone, please be nice. Jack will be the one that will send us our reminder emails, our Zoom links. There'll be other members of the team participating in this, but he's your main primary point of contact. So thanks, Jack, for all you're doing on the back end. And if you could just put back up the agenda, that would be great. There we go. So we've just done introductions, and I think, you know, in my opening, I spoke about like why this task force matters, and just kind of underscoring what our Community Board 14 chair shared. This task force came about and negotiations as we worked on passage of the Resilient Edgemere Plan. We looked and used that project to really push forward an agenda that, quite honestly, from a community stance, has been in the works since the day that Peninsula Hospital closed. Anyone who lives on the Rockaway Peninsula knows how important it is for us to have a trauma hospital. And so this is the initial step. We, from the administration, received like an agreement that we would look at this in multi-pronged approach. So we all know that we have a health and hospital Gotham Center facility that is slated to come to the Rockaway Peninsula that will focus on ambulatory care. That's a relatively new model for the city and how they work. And if Dr. Katz, if you want to jump in at any point, feel free if you want to talk about a little bit about what the Gotham Center looks like. But the long-term goal is really to establish a trauma facility here on the eastern portion of the Rockaway Peninsula. And when we talk about trauma in this effort, I've learned to talk about it and be specific. And Dr. Tepperman, feel free to join in at any point. But when I spoke about trauma initially, trauma could be things from emotional to physical. And so when I talk about trauma and what I hear from people on the ground in our community is that we need trauma that if someone is shot, they are able to get care. If someone drowns, that they can get immediate care. If there's strokes, heart attacks, any instance where every moment matters and counts. And Dr. Vega, also, you can have all the folks that specialize in this space, feel free to jump in. But this has been my working and growing understanding of when we talk about trauma care. So I think it's important to kind of put out there what those definitions look like. And as Dr. Katz mentioned, you have different levels of trauma care. It could be a level 1, 2, 3. Our goal is at level 1, as I'm sure Sonia Moise would say here. But definitely for me, I do not want to see less than a level 2. But I am fighting for a level 1. So I just want to make my position clear for anyone who was confused or didn't know, so that we're all on the same page. But Dr. Tepperman, I would love for you to share from your perspective, a level 1 trauma facility, what that looks like, and what a community could expect from a trauma 1.
So specifically from a level 1 trauma center, Dr. Katz mentioned Bellevue and Jacoby. One of our colleagues mentioned Kings County. So those are all level 1 trauma centers. And, you know, it's interesting. So these designations are all come from the American College of Surgeons. So the difference between a 1, 2, and 3 really decided by the American College of Surgeons, and New York State adopted their model about 10 years ago. So just to let you know that the basic difference between a level 1 and a level 2 center is that a level 1 center has a significant research requirement. Clinically, they are similar, not identical, but similar. And then a level 3 trauma center is one that has fewer resources, but can stabilize a patient and operate on a patient if necessary, and then send them on to a higher level of care. A level 1, you know, as Dr. Katz mentioned, right, Bellevue, for example, is the place that the president would go. So you can imagine that there are a lot of services there, right? Neurosurgical services, operating room, blood bank, you know, or very intense orthopedic surgery. All the subspecialties have to be very well resourced and funded for a level 1 and a level 2 trauma center.
Thank you for sharing that, because I think it's important that as we have this conversation, that everyone is operating from the same definition and understanding of what trauma means, what the different levels are. We know that Peninsula Hospital was a level 1. It had a heliport on it. There are different, types of level 1s that exist, but we know that right now in the last census that our community grew by about roughly 20,000 new individuals. And then we project that there will be even more growth because of the development currently underway. And we have people moving in every day right now. And so the trauma facility that we're looking to bring is one that's not in my conversations, Dr. Katz so eloquently put it, it's not about old data. It's about what we're projecting to make sure that it's going to meet the needs of what is to come. And I think that's important. And Dr. Katz, I don't know if you want to add anything to that.
Well, I just want to emphasize something that you said, which is that trauma includes anything where time really matters. Because I think when many lay people hear trauma, they only think car accident or drowning or fall. But, when somebody has a stroke or somebody has a heart attack, minutes mean muscle loss, minutes mean brain loss. And so just to make sure that we're all thinking about all of those things, as opposed to what ambulatory care seeks to do and what is done well in the FQHC out in Rockaway and what we'll do at our facility, an ambulatory care facility, that's more, things that you need, to get your regular diabetes medicines. You need to get your hypertension medicines. You need help on diet and exercise. You have a bad cough. You have back pain. But here, what we're talking really about is how do we provide the care that people on the Rockaway would need in a case of either a physical trauma like an accident or a medical trauma like a heart attack or stroke. Thank you.
Thank you, Dr. Katz. And so the next thing is goal setting. And so Dr. Katz, I'm going to ask if you don't mind leading this part of the conversation in terms of the goal setting.
I'd be delighted. So when the council member and I were talking, we agreed that the most important thing from the task force would be a set of recommendations that she could then carry in the city council, and which we could ask our state and federal partners as well to help to support. So we are looking for something that is specific to the services. So it's very important that we be able to say that we are looking for a facility that provides the following things. We needed to say approximately where on the peninsula it goes. But what we're not looking for is it needs to be this amount of square footage or, exactly this lot. Those, from my point of view, are implementation issues. But what the services provided by the facility are, who provides those services, for example, is this going to be a collaborative project with one of the existing hospitals? Is this a completely separate project that we're imagining? The council member raised the issue of a helipad. Is this a hospital with a helipad? Are helipads, I don't know a great deal, but I hope in our process to learn more about where in the Rockaway you could land a helicopter. That's always an important issue. Is the top of a building, is it only that they would be coming in? Can one pick up a person with the helicopter? So I mean, these are, I think, really important issues that if by the end of our task force time, we could say we met together, we understood what it was that the community needed, what the gap was, had a clear idea of the services, and we will need, and Dr. Tepperman is great at this, we will need to look at volume numbers because volume affects the financials about a facility. So whenever you're looking at a particular level, right, let's say you're at a level 1 where you need a 24-hour neurosurgeon, then you want to know about what is the volume coming to that neurosurgeon. Because that's ultimately how you would pay for the services of the neurosurgeon. So I think we, during this period of time, and I'm going to take the prerogative of getting a little bit into the next item, which is the work ahead. One of the things that we might all want to articulate in this process is what are the data feeds we need. We're all at the beginning of this process. I'd like personally to know more about the number of transfers that go to another hospital. I'd like to know more about the size of the population in the Rockaways and at any given time, how many people one would anticipate would have a stroke or a heart attack, right? And as you would imagine, it's not just the literal numbers of stroke or heart attack because you don't always know for sure, right? So it's really, you know, the number of people who would be picked up with symptoms that would be suggestive of a heart attack, or the number of people who would be picked up by an ambulance suggestive of a stroke. So you want to have a sense of what is the volume of transports that we would expect. I think it would be interesting to learn a little bit more about the history of Peninsula Hospital, exactly when they closed, what were their volumes, what was their staffing like. I think that might be helpful to us in our deliberations. The council member already raised the issue of what is the size that Rockaway is going to grow to? What is the age distribution, right? These are figures that we can get from city planning. One provides different kinds of services for younger versus older populations. Strokes, heart attacks tend to occur more in older groups. So you have to know not just the size of the population, but what the age distribution is like. And so I think if we together were able to put together that information and share it with people on how many individuals we anticipate would fall into each group, that would help us quite a lot in our deliberations. Jack, I think the council member is now on a call that she had to take. Should we, can I open it up and ask people to talk about their expectations or what data they think they would need in order to make good decisions?
That sounds great.
So I'm wondering if people want to, Jack, should people use the raise hand function? Do people know how to use the raise hand function?
That works.
Okay, so if people maybe just to get us going, I'm gonna call on my wonderful colleague from Los Angeles, who I'm so happy to see, Dr. Vegas. So from you're running an FQHC, so you're seeing people in the ambulatory setting. But you also know that sometimes they're more critically ill and need services beyond what an ambulatory care facility can provide. From your experience with your patients, what do you see as some of the greatest clinical needs?
You know, just today we sent 2 kids, unfortunately, by ambulance to the hospital. respiratory issues. We had a patient die in our lobby about 4 months ago, who came in and couldn't breathe very well. So we're seeing very sudden onsets, it seems like, from results of COVID infections and so forth. But besides that, heart disease, and I know that there will probably be a lot of need to address heart attacks and strokes for sure. We're seeing that as a major need in the area as heart disease continues to increase. You know, our three comorbidities are heart disease, obesity, and diabetes. And if you have all three, what are you looking at in terms of what could be traumatic encounters for these patients?
When your patients get hospitalized, where do they usually get hospitalized?
Depending where, many of our patients do go to Jamaica Hospital, and occasionally they go to St. John's, but if it's something more traumatic, they'll go to Jamaica or yeah. Here in Brooklyn, we have a whole other set of issues.
Understood. And I think someone from Rockaway, correct me. I'm Brooklyn born and been on the Rockaways many times, but I don't always know. But what I've heard is that the travel time to Jamaica Hospital, depending on exactly where you are on the Rockaway, and of course, traffic conditions, could easily be 35 or 40 minutes.
Yeah, it's horrible. It's horrible. That's why when someone said the helipad, I think it's very much needed there.
Does Jamaica Hospital have a helipad? Does anyone know?
I don't believe that they do. But that's
other
something to find out.
Yeah.
But I don't believe so.
Okay, that's good. And are there places on Rockaway where let's say the facility we built had a helipad? Are there places on Rockaway where you can land a helipad to pick someone up?
The answer to that, doctor, is yes.
Okay, because that's obviously, I mean, some hospitals have helipads, at least to take someone to another facility. But if you're going to pick up someone, and we all recognize the geography of the Rockaways is a very long, thin peninsula. And so being able to transport someone with a helipad can be incredibly helpful, so long as you can land the helipad.
Dr. Katz, can I add one more thing? I know this hasn't been mentioned, and a lot of people don't often think of this in terms of trauma, in terms of like time. But more and more trauma centers are getting those emergency psychiatric rooms. So I don't know if that's something that would be considered for here, but we do see a lot of patients coming in with some major psychiatric problems that we have to send them out to somewhere. And I think that is the growing trend, to have those safe rooms and so forth. So
to that point, Dr. Vega, I'm sorry, Dr. Katz, I will just add, I believe St. John's may have something to that extent that they recently just opened up a wing for, if I'm not mistaken. They do. And the goal is like really to find something that supplements the care that we already have on the peninsula, to not necessarily harm organizations like St. John's, but to be able to strengthen that health infrastructure. But I do believe, to your point, that they recently opened up one, but we should put that on the list of things to just confirm and verify. And I see we have Sonia's hands up as well. Sonia.
Hi. My hand was up initially because I thought there were going to be some questions that were going to be asked. But to follow up on your question, council member, yes, St. John's does have that in place. They have an entire psychiatric unit, and they have all of that access when it comes to psychiatric care in place. As far as you're right, as far as like duplication of services, is something that we don't need. And also, I guess the competition we don't need. You know, for those who don't live in Rockaway and for those who do, obesity is a huge factor. Obesity, and of course, as the doctor was saying, diabetes. And we also have a lot of patients who have heart failure, right? So heart disease is the biggest. And we also have a lot of patients, a lot of cancer patients as well. And as you stated, our prior councilwoman, you know, I look at, you know, the Peninsula as if we need a level 1 trauma center, and I wholeheartedly think that we do. The population is only going to continue to grow. And, you know, I'm not looking at a standpoint of, you know, GSWs to the head or to the chest and things like that. I'm more so concerned of the strokes. I'm more so concerned of the heart attacks. I'm more so concerned of all traumas, you know, under that one umbrella when you say trauma, all physical traumas.
Okay.
And I just think that we need those resources.
Thank you for that. Betty, I see your hand is up as well.
What I thought about is during the summer, we have a huge influx of people from all over on the beaches and everywhere else. And we have experienced a number of drownings. So I think we also have to think, you know, have that into consideration. And also with one of the things we have here a lot is asthma, because the planes fly over us, and there's a lot of, you know, the fuel from the plane. So that was something that I know there's a large history of asthmatic, you know, children and adults. So I think we also, these are some other traumas. And I'm thinking, especially in the summer, I hear those planes over my head so often. So hopefully, you know, that should be a big consideration, especially that there are a lot of extra people in the Rockaways during the summertime. So that's.
Are you back? Hi,
Hello.
I don't hear anybody
Can you hear
speaking.
me? Oh, there we go.
Yeah, can I speak? I'm good?
Yes.
Okay,
Yes.
no, Betty, I'm amazed that you can still hear the planes. I'm living here so long, I stopped hearing them. Okay, but I guess I'm breathing in the fumes. I'm also very concerned about the beach. You have a huge long beach, 10 miles long, and drownings happen, boat accidents happen, things happen. And really the closest location, you know, is if it's on the east end, it's usually out, you know, in Nassau County someplace. And if it's on the, I mean, like for instance, the Jewish community sends most of its trauma situations either to LIJ if they can get them there, or out to Nassau Community Hospital, which is closest, I think, and even that's 10 miles away. So we're really, really sorely lacking in terms of places to send heart attack victims, stroke victims, and the like. Every minute, every second counts. And so this would be a huge lift for all of us. In terms of the helicopter thing, you know, we do have a long beach, and if it's a, you know, in the middle of the day, you could land a helicopter on the beach. You have plenty of space there. It's been done before. So I'm just saying, I don't know if that helps. I don't know if that helps, but it's something. You know,
now, Richard, you just raised a very good point that I'm glad you brought up, the Jewish community, because when people look at the data set in terms of where folks go, I think that there has been limited ability to capture that community in terms of where the Jewish community goes in the need of like healthcare.
Yeah, well,
and
they
we know
stopped
it's
going to
not
St. John's. They won't go to St. John's.
Right. And I learned that in the pandemic that, you know, the Jewish community does not go to St. John's, but you pointed out that Long Beach or Long Island, because a lot of the focus, and just in total transparency, St. John's Hospital recently did an assessment also where they've been trying to collect data to look at trauma care. But I think that I, along with my colleagues in government, have made sure we continue to underscore we have to look beyond Jamaica Hospital, because we know even outside of the Jewish community, not everyone will go to Jamaica Hospital. If they have the resources and the ability, they'll go to an NYU network hospital, a Northwell network hospital. They're delivering their babies all across this, the city in different ways, and pediatric care as well. So
I'll give you all that. I'll tell you right up. The babies are being born either at LIJ, North Shore, or what do you call it? The one in Oceanside. Just mentioned the name that what do you call it? South Nassau. South Nassau.
Yeah.
Those are the three places that they go to. There are some doctors that have rights at the hospital in Valley Stream. I forgot the name of that. They go there. Depending on your doctor, that's where you go. But those three hospitals really get the bulk of the Jewish community, and even South Nassau is not a preferable hospital anymore because they feel the level of care that's best is either, besides the city hospitals, like you mentioned, NYU, is LIJ and North Shore considered to be top, and that's where they'll want to go. You could really probably get data from Hatzalah because they're doing literally dozens of calls a day. And Hatzalah is the Jewish ambulance service. I'm sure people in this room know about it. Their response rate is great, and they have data. They have to keep data on where they're sending their patients, so you could get that. And I'm sure Hatzalah really would be great to bring into this because they're dealing with the Jewish community's trauma issues, and they might want to weigh in on what they would like to see. So.
No, thank you for that. And then in the chat box, I see that Jerry, you asked, do we expect to seek okay for a cath lab? I'm gonna defer to Dr. Katz on that one.
Yeah, I think that's a good question. I would say it's probably not the very first thing we would do in a facility. But ultimately, yes. It has a corollary with stroke. Is the modern care for stroke patients now is to try to remove the clot as quickly as possible. Just like that's the goal with a cath and center is to be able to open up a cardiac artery that is blocked as quickly as possible. All of these things, generally, you have to open up a facility first in order to then apply for additional certifications. But I think this is exactly the discussion that the council member and I wanted to have, which is what is it that right now we're just calling it a facility. What are the services that are most important? And I think when we look at the volumes of people who are on the peninsula and have chest pain or have symptoms of stroke, we'll have a better sense of cath lab and a clot lab for the stroke patients.
And also, someone had said it earlier in terms of, and I don't know if this was Dr. Tepperman, but had mentioned something about like a blood bank type of component. And I was wondering if there would be opportunity to partner with the blood bank itself, because I know last year when the council had to vote on its land use item, I had mentioned to them the interest in seeing them expand beyond Manhattan into the outer boroughs. And I'm wondering, is that something that could be attached to, because when you think about the trauma hospital, I keep on hearing how expensive it is. And I know, and Dr. Katz, at this point, it gives me a headache hearing people talk about, profit when we're talking about lives. But I do wonder if that helps in any way in terms of bringing in finances into a hospital.
I think it's a great, issue on how the blood bank can help us. Obviously, blood banking is critical to a trauma center. Can't have trauma center without the ability, because that's how you save lives in cases of accidents. It's all about how quickly can you get blood back into the person and how quickly can you stop the bleeding. And that's how you save lives. And I'm very proud that, there have been people who've arrived to our trauma centers who were in some way functionally not alive when they arrived. They had no pulse, they had no blood pressure, but our great surgeons like Sheldon, pumped the blood and stopped the bleeding, and then they came back to life. So I think figuring out how, this is going to take a lot of effort, and everybody's going to have to do their part, including the blood bank. And as you say, you just gave them, the ability to move their facility to a better place. So it seems ripe to ask them what they can do to help us.
That's good to know also. So Jack, let's add that onto our list of folks to reach out to. So just doing a quick time check, we're at 4:56. On these calls, we want to be extremely respectful of people's times. So generally, we would look to keep it as tight as possible. So at least an hour. Sometimes it may be more than an hour, depending on what we're bringing back to report out and what the discussion looks like. So I want to allow for the community in particular to provide a couple more comments before we begin giving closing remarks, to just talk about more of what we'd like to see. What are you hearing? A lot of you represent communities. I know, Betty, you have worked in the trauma space as well in Brooklyn. Would love to hear some feedback from you, Reverend Mullins, Dolores, anyone, if you want to give some more comments, ask some more questions, so that this can help shape the conversation for our next meeting.
Hi, it's Dolores. Sorry, I'm babysitting a 17-month-old, so just two things. My great niece. Once a week I watch her. So two things I wanted to mention in terms of the location. Certainly the land that's available is further east from center, and I think everyone is clearly of the understanding that that's where it needs to be, but we have to make sure we keep it far as close to center of the peninsula, which is about 73rd Street, as possible, so that those from the far west end can get there in a reasonable amount of time. And the other point I just want to make is the blood bank to me is critical. I went to Peninsula and for immediate blood transfusions on order of my doctors, and I waited 10 hours to get blood. So blood is certainly critical. And I'll hold anything else for our next go round before she starts yelling. So I'm not paying attention to her.
Thanks, Dolores.
Thank you. Okay.
Reverend Mullins, Betty, any additional remarks that you guys want to share?
Well, I think a lot of the stuff we talked about, what is needed, and I know one of the things you said, Silvina, is that when we were looking at it, we were thinking in terms of how many people are going to use it. Would it be, I know you talk about the dollars as opposed to people's lives, but my concern also is that, with this administration, who may say, great, it's great we have it, and put the money out, but when another administration come in and they look at the Rockaway, which is what happened with Peninsula. I mean, we had Peninsula for all these years, and then someone came, did a study and said, oh, we don't need Peninsula anymore. And they just closed it down. So my concern is really the long, if this is something that we can maintain, because of course you have to bring in the dollars, because that's what people look at eventually. Everybody looks at that. So, that we would have the services and all that, and that we wouldn't be losing money, so that another administration comes in and go, you know what? They're losing money. We're going to close it down. So, that's something that's been, I have been thinking about also. So I think we also need to look at that in terms of another administration coming, another person coming, and what their needs, I mean, you're gung-ho about it, so am I, but after you have term limited, somebody else comes in, would they be gung-ho, or would they be like, how often do we use it? So I'm hoping that if we do get it, or when we do get it, that everyone will not leave the peninsula and go somewhere else, like a lot of us do, but we will utilize the trauma center.
No, that's a very, very good point. And that's why, I know I have an ambitious goal here. That's why we have to make sure that whatever is built right. So for me, I think success looks like a teaching hospital. It looks like an endowment. When you look at some of the more successful hospitals, those are some of the key ingredients that are a part of those. So making sure that we get buy-in. I know, there are other private hospitals like Johns Hopkins, who works very closely with Reverend Mullins. There are folks like Bloomberg out there that has money that looks to kind of put their money back into community in these days. So looking to see how do we strike those partnerships and entice them to come to Rockaway is important.
So Savina, if I could, I want to touch, just piggyback on something that Betty talked about as far as ensuring that the facilities would be utilized at its fullest. What old habits, they say die hard. So what would be, and I guess that's why we're in this meeting. What would be the plan? What would the plans look like for like promotions and campaign? This is something that should be out there that people will be anticipating, and people should be anticipating. We don't want it to just happen and then people are used to where they're used to going and they just continue to go to where they're going, rather than us putting it in a way where it's attractive and it's fascinating. It's ours. This is what we've been waiting for. What would that look like? Be it campaign ads, whatever it is, promotions, flyers, where however you do it, but it should be at a place where it's well known that it's there and it will be utilized. The other piece I touched base on, I think Betty touched base on that too, if not you, is ensuring that this is a state-of-the-art facility, a modern type facility. And you mentioned a teaching facility, which is very attractive now. That's you're right. Most of the modern facilities are teaching hospitals and teaching trauma centers and whatever they call them. Something we may want to take a look at, some of the best practices. So we may want to visit some sites like something like what Johns Hopkins doing in Baltimore. You may want to go to Massachusetts. There's a fascinating trauma center in Massachusetts. So we would probably want to, these are things that we'll have to do, like doing our homework, because it doesn't happen overnight. And we may want to go after some of the money people. You mentioned Bloomberg, and some of the other corporate conglomerates that is willing to put money into something of this nature. So again, I applaud you for doing this. It's going to be a lot of work, but it's worth it.
Thank you, Reverend Mullins. And so we are now at 5:04. I'm gonna ask Jack to just pull up the next date, the list of meeting dates. So I just want to make sure everyone knows our next meeting dates schedule. It'll be held on the third Thursday each month at 6:30 p.m. So the next meeting will be on December 15th at 6:30 p.m., followed by January 19th at 6:30 p.m., February 16th, March 16th, April 20th, and May 18th, all at 6:30 p.m. Jack will make sure that everyone gets the Zoom link ahead of time, and you'll get a couple of reminders like you did this time. And we encourage you to do some fact finding in the community, talk to people, listen to folks, and hear what they're saying so that when you come back, we're having a productive conversation in terms of the interests of and needs of the community. And so with that, I want to just allow Dr. Katz to give any final words before we close out.
Only that I promise we will work with you, council member, and Jack, and some of the people on this call to bring data to the next meeting, because I definitely think that data on need, because everything should always follow from what people need. So we don't start on dollars and cents. We start on what's the clinical need, and then we ultimately do have to fund it. But I want us to begin with what's the need, and so we'll work with our colleagues with EMS. We'll look at volumes that are going to nearby hospitals and try to bring to people a sense of if we when we open a facility, what we can expect. And I think that will help to crystallize the conversations.
Thank you so much for that, Dr. Katz. Thank you, everybody who was able to join and being a part of this conversation. It is going to require dedication and commitment on this task force for us to be successful. So we can want it, but we got to put in the work to get it done. And this is just like step one of other steps to come. I see the Assembly member wants to add something before we close out. Go ahead, Assembly member Anderson.
Yeah, thank you so much, Majority Whip and Dr. Katz, and to all of our task force members. This is a fight for the long haul to restore what was taken away from us in 2012 when Peninsula Hospital left our community high and dry. And so, like the councilwoman said, it's going to require grit. It's going to require some resiliency. It's going to require us being focused and committed to it. This is not going to be easy. We're not going to get wins, in the first few weeks or even few months, but it's going to take us to really, really grind out on this issue. I'm committed to that. The Majority Whip is committed to that. I think Dr. Katz just said he's committed to that. The state senator is committed to that, and our district manager and our community board chair and all of our leaders are committed to this. So y'all, let's work together and let's deliver a win for our district and for our community.
Thank you so much for that. And I wish everyone a safe rest of your evening, a happy Thanksgiving, and look forward to talking to everyone on December 15th at 6:30 p.m. Thank you.
Happy Thanksgiving, everybody.
Thank you.